everyone, nice to meet you here. During today's short lecture, I will explain to you briefly about another very common health condition, which is the arthritis. Arthritis affects a lot of elderly people in Australia. The statistics show that around 3.9 million people in Australia suffer from arthritis, which is equal to 1 in 6 people. Among this population, 2 million people are at their working age and their age is between 15 to 64. So from here we can see that arthritis not only attack older people but also attack young people and also can significantly affect people's mental health and cause serious financial burden. Government and healthcare facilities have been spending a lot of money on treating this condition. During 2015, just within 1 year time, $5.5 billion were spent on arthritis treatment, and the medical expenditure is continuously rising with years. Therefore, it's really important for us to understand this condition and then take proper actions to prevent it. So let's have a look at what is arthritis. Arthritis mainly affects your joints. The joint is the section which connects two bones together. We have different joints around our body. For example, our elbow, the knuckle, the knee, and the heels. The joints helps us to properly move our arms and legs. This is a picture of the joint. So these are the two bones, and in the middle this is the joint. And inside the joints we have different components. Firstly, we have this cartilage. Cartilage is a soft bone which covers the end of the bone to act like a cushion to prevent two bones from gliding with each other. So cartilage plays an important role. Without cartilage, two bones will connect together and then people could not flexibly move their arms and legs. Now another section is called the synovial fluid. Synovial fluid is a liquid stuff which fills inside your joint to act like a lubricant, so it can lubricate the bones. The layer which covers this synovial fluid is called the synovial membrane, so it actually holds the whole fluid inside. Another layer which covers the whole component is called the joint capsule. Joint capsule actually hold all the components of the joint together inside. Between the bone and the muscle is the tendon. Tendon actually connects the bone with the muscle. So this is the whole picture. Now let's have a look about the different types of arthritis. Arthritis include all different types, but there are three most important types, which are the osteoarthritis, rheumatoid arthritis, and gout. Now these three types are the most common ones. So firstly, let's talk about the osteoarthritis. Osteoarthritis mainly affect the older people. When people have osteoarthritis, that means the cartilage inside the joints gradually get lost and broken down because of the age. So when people get older, the cartilage, because people constantly use their joints, so the joints have been used for years and years. Because of this wear and tear, the cartilage gets damaged and gradually get lost and broken down. And the broken cartilage will spread around inside the joints, and also because of the loss of the cartilage, two bones start to rub with each other and then make this section become inflamed. There's inflammation in here, and then when it is inflamed, people's joint will become really swollen and red, suffer a lot of pain, and also become really stiff. So people with osteoarthritis cannot flexibly move their joints. So the movement gets very stiff. Now, what kind of people easily to suffer osteoarthritis? I said elderly people and also those people who actually repeatedly use their joints because of certain types of the work. Also, people who are obese, people with obesity, now these people also easy to suffer osteoarthritis because their joint hold heavy pressure because of the weight, put weight on the joint and make the joint easy to get also damaged, and the cartilage easy to get lost. So osteoarthritis is mainly related to age and is caused by wear and tear. It is caused because a cartilage gets gradually lost with age. So this is osteoarthritis first type. Now we're going to talk about the second type, rheumatoid arthritis. Now, rheumatoid arthritis is not related to age. It could affect even young people. Rheumatoid arthritis is an autoimmune disease. What means autoimmune disease? That means your own immunity actually attacks your own body. Now, your own immunity should normally attack the other pathogens in the environment to help your body to fight against the infection. However, when the immunity gets damaged itself, the immunity doesn't work properly, and instead of attacking others, it actually starts to attack yourself. So with rheumatoid arthritis, your own immunity starts to attack your own joint, and it will damage your cartilage inside the joint and make it actually fully lost. So when the cartilage gets fully damaged because of this immunity attack, it is very serious actually, and the two bones will totally connect with each other, and people will suffer a serious symptoms within a very short period of time. Because this is not caused by age, so it happens really suddenly, and the immunity actually suddenly attack your joint and break down this cartilage in a quick time. So it's really very serious condition, and it's hard to be treated. Now, normally rheumatoid arthritis is highly related to the family history and the genes. If certain people, if they carry that genes, now the genes is very vulnerable and very susceptible to get this condition. So some people's immunity actually naturally easy to become dysfunction and then attack their own body. So rheumatoid arthritis is an autoimmune disease which could attack all people with all different ages, and it actually is caused by your own immunity attack your own joint and break down your cartilage in a short period of time, and it's more serious than osteoarthritis. So hopefully you can understand this. The next arthritis, another type, is the gout. Now the gout actually can affect also people with different ages. Now what caused the gout? The gout is attack the joint as well, but it's because that in your body, in your blood, a substance called the uric acid become high. So the uric acid, now uric acid is actually a waste product which stays inside your blood. So if it is accumulated in a high amount, the uric acid, this uric acid can form the uric crystal and then start to deposit into your joint, and then triggers the inflammation, triggers the very uncomfortable feeling on the joint. So people will have the huge inflammation and feel intense pain, very, very serious pain. So gout actually is a serious arthritis caused by the accumulation of the uric acid in your blood, and then the accumulation of the urethral crystals inside your joint. So why people have the high amount of uric acid? Now uric acid is actually a byproduct from the purine. So it's actually metabolized from the purine. So purine is a natural substance which stays in our blood. Purine can come from different types of food, especially the seafood, the shellfish, or it also comes from the alcohol, especially the beer. So if in your blood you have too much amount of purine. Now, because when the purine actually breaks down, it will produce this uric acid. This is a waste product from the purine metabolism. So if the purine level is high, they will produce high amount of uric acid, and if the uric acid stick into your deposit into your joint, it will cause gout, will cause the inflammation and very serious pain in the joint area. So to prevent gout, people need to restrict the consumption of certain seafood such as shellfish, and also should restrict the consumption of beer, because beer contains more purine. So among all different types of alcohol, actually beer contains more higher amount of purine. So remember that purine is the main cause of the gout. Also, people with poor kidney function, because we know that kidney actually helps the blood to filter out the waste products. So if the kidney is impaired, kidney could not clean up your blood, could not properly eliminate your uric acid, then people could also build up this waste in the blood and could cause the gout. If people with poor kidney function, gout could also happen. So now I hope you could have a brief understanding about these three different types of arthritis. Osteoarthritis, so let's make a small conclusion. Osteoarthritis is related to the age, is caused by the loss of the cartilage because of the wear and tear. Rheumatoid arthritis is an autoimmune disease. It's caused by your own immunity attack your own cartilage and make it lost. Gout is an arthritis which is caused by high amount of uric acid in your blood, and when it is really high, it could form the crystal and deposit into your joint to make you suffer serious pain. Now, then let's have a talk about how to treat this arthritis. If you have arthritis, what are the best treatments? Because you're going to suffer a lot of pain, you're going to suffer a stiff joint and also swelling. So good treatments include, for example, have hot baths and massage. So every day you should have a hot bath. Hot baths, stay in the hot water, sink your joint in hot water. Hot water can really soothe your muscle, relax your joint area, and prevent the stiffness, treat your stiffness, make you feel more flexible with movement. So have a warm bath every day. Another thing is that do the massage. You can apply the oil on the joint areas and give a good rub in that areas. Now give a nice massage. Massage also helps to treat the stiffness. Also, you can consider avoid repetitive movement. So if you have arthritis, you don't want to use your joints too often. So avoid repeatedly using your joints. And you can consider some slow movement, slow exercises such as yoga, such as meditation, a slow movement and slow walking. This light exercise or even hydrotherapy, put your body into the water and slowly move your arms and legs. Now this slow movement could help you with the arthritis pain and make you feel more relaxed. If you suffer from pain, also you can consider, or if this treatment don't help, you can consider taking medications. There are some anti-inflammatory medications you can get, such as the ibuprofen, aspirin, naproxen. Now these medications are easy to buy from the pharmacy and it's very cheap. So this can treat the pain triggered by the inflammation, because we know that arthritis is inflammation related to the joint. If you have gout, you should restrict your intake of the, you should control your alcohol intake. Don't drink beer and don't eat too much seafood, for example, especially don't eat the shellfish. And arthritis, is a very common condition. So because you're overweight, again, like if you are obese, because your weight actually put on the joint, so your joint actually hold a lot of weight. So if you want to treat it, you should consider losing weight as well. So I really hope this little lecture could help you to have more understanding about what is arthritis and how to properly control it. Thank you very much.